Right, everyone. Good afternoon, and thank you for joining us. I'm Tom, the owner of Physio Inc. in Sutherland and Engadine, and this is Rebecca, our senior exercise physiologist, who is going to be doing all the hard work and talking today. Essentially, today, we're really glad that you're able to come and to take part of it. We really like doing these things. We have an opportunity to give back to our local community, to run free webinars like this one about things that are pressing at the time and we think are actually going to be like really helpful for people. And obviously, a lot of people have had COVID in the local area, and especially we hear from teachers and sports coaches and parents, and they wonder, when is it okay for my kids to get back to doing their usual physical activity, and when is it okay for me to get back to doing it after an episode of COVID-19? And it is varied, and Beck's going to cover that, and it's more about outcome and how you feel rather than a strict structure. But a bit more about Beck first. So Beck has over 8 years experience as an exercise physiologist. And I know a lot of people are thinking, what the hell is an EP? An exercise physiologist. But essentially, imagine that you can go to someone that can give you an assessment and then prescribe you something that can help with things like heart conditions or mental health and lung problems, chronic conditions, aches and pains, post-surgical rehab. Imagine if there was a prescription that could help you with all of those things and make you better with basically zero side effects. And there is something, and it's called exercise. And Beck, as an EP, specializes in exercise prescription. And it's not just someone that's done a weekend course, obviously. Rebecca's been to university for 4 or 5 years with EPs, and then done a bunch of clinical experience as well, and has a thorough understanding of the body and what it actually means to get people moving, especially those people that might be a bit concerned about it. So that's what an EP is. And also, of course, she can tell you about how to get back into action again and physical activity after having COVID. So thanks for coming along today and making this happen for us. So I'm not going to take any more time. I'm going to let you guys go for it and get into the presentation and get out of your way. But enjoy, and we'll see you around.
Thanks, John. All right. Just getting organised. Okay, great. All right, thanks, Tom. All right, so as Tom just explained, today I'll be covering return to physical activity after COVID-19. So it's going to be really generalised. So I would recommend as well to seek advice from health and medical practitioners, such as myself. Exercise does need to be more of an individualized approach, and things can be tailored specifically to each individual. All right, so getting started. Based on professional experience, it has been suggested that after mild COVID-19, some people may experience prolonged recovery, so particularly when getting back to physical activity. What we've found is that there's increasing recognition of potential long-term complications. So you might have heard of post-acute or long COVID, cardiopulmonary disease, and psychological concerns. So what we're going to be looking at today is a pragmatic approach about returning to physical activity after COVID-19. And here the focus is on those who had symptoms and who may have also then lost fitness or had a prolonged period of inactivity, but who do not have enduring post-acute 19 illness. So important to note that I'm not really going to be covering those who had more severe symptoms or who were hospitalised, and not really going to be covering the post-acute or long COVID today. Also important to note that the information is based on the most current evidence, so that's generally around 2020 and 2021. It's also professional experience and consensus statements. And I'm going to be referencing the reference that's on the screen at the moment, which is by Salman et al. And that was a publication that was published in the British Medical Journal in 2021. If you do have any questions, please feel free to pop them in the chat box, and I'll do my best to answer them throughout the presentation as well today. Okay. So the areas that we're going to look at today is COVID-19 symptoms, the potential risks of returning to physical activity after COVID-19, how clinicians determine if someone can safely return to physical activity, and how clinicians may guide back to physical activity. So it's going to be very generalized. Some general phases of return to physical activity, and touching on some exercise intensities as well. All right, so probably pretty familiar with some of these symptoms. The COVID-19 symptoms listed here. So you've got fever, continuous dry cough, fatigue, difficulty breathing, sore throat, headache, and that's muscle and joint pain there as well. There's a good reference tool here. The World Health Organization published this in 2020, which also includes some other symptoms. So, unfortunately, some people might be getting chest pain, loss of taste of smell as well. There's obviously some more symptoms on there as well. Okay, so moving on to the potential risks of physical activity after COVID-19. So the current understanding of recovery from COVID-19 is limited. The preliminary research has actually highlighted a few key concerns, which I'll touch on today. So the first one being cardiac injury. So you might have heard of viral myocarditis. So essentially that's, inflammation of your heart muscle. Also a concern is thromboembolic complications such as pulmonary emboli, which is one or more arteries in the lungs being blocked by a blood clot. And the third concern is psychological concern. So that's examples being PTSD, anxiety, and depression. So understandably, some of these potential risks, particularly the viral myocarditis, lead to caution when health and medical professionals advise on return to physical activity and exercise after COVID-19. And it's also important to note as well that there may not be a perfect solution given the current uncertainties and variability of resources. So the exercise professionals and the experts in the area are advocating for a pragmatic approach, basically enables gradual return to physical activity while mitigating the risks. Okay, so if someone was to come into the clinic, just giving them a bit of an idea of the things that we'll be looking at doing. So risk stratification is very important. So you do your usual screening, which can involve like going through medical, family history, injury history, physical activity history as well, injuries, lifestyle, medication, the list goes on, doing some assessment side of things as well. But the thing that we'll also be including is some COVID-related things, so asking about symptoms that you might have experienced, the duration and severity as well. And the purpose really is to assist in maximising safety and reducing the risks. We're also trying to exclude features suggestive of myocarditis or post-acute COVID-19 as well. Then moving on, another thing that we'll look at is, is the person physically ready to return to activity? A bit of a consensus agreement is that a return to exercise or sporting activity should only occur after an asymptomatic period of at least 7 days. And something that I found that was published in 2020 in the English and Scottish Institute of Sport, they suggested that before initiation of sport for athletes, activities of daily living should easily be achievable and be able to walk for about 500 metres on flat ground without feeling excessive fatigue or breathlessness. So then it's important for us to consider what someone's pre-COVID capacity is, because we may not all be athletes. So it was quite good in the recommendation by Salmon et al. That they actually considered each person's pre-illness baseline. So then we look at, they can potentially commence at a level tolerable for them. And then obviously exercise is tailored and guidance is provided accordingly there as well. Okay, so looking at ongoing symptoms. So ongoing symptoms may be indicative of post-acute COVID-19. And so that's where we have those discussions and recommend people to review with a medical practitioner. So a good starting point might be with a GP there. It's been recommended, again, by Salmon et al. For people who did not require hospital treatment, but had symptoms suggestive of myocardial injury, such as chest pain, severe breathlessness, palpitations, symptoms or signs of heart failure, syncope or pre-syncope, to review with the GP. So getting that medical practitioner advice and looking for further assessment there, because they may require further investigations and they may also have restrictions on exercise as well. And then moving on to respiratory system symptoms. So these, persistent cough and breathlessness, they're expected to resolve after several weeks. However, if symptoms are progressive, they're non-resolving or they're worsening, it may indicate pulmonary vascular complications. So again, be recommended to review with a medical specialist there as well. Another concern, how talking about these sort of things is the person physically ready to commence physical activity? So psychologically ready to commence physical activity. So physical activity, as we know, may have a big impact on mood and mental health. So Salmon et al. 2020 tries to consider mood, sleep, appetite, and motivation. So again, reviewing with the GP if further support is required, they can obviously assist you further as well. All right, and then this is part of an infographic from Salmon et al. So what this is saying is a summary of what we just covered. Looking at the top here, so essentially if you've answered yes to any of these top ones, so if illness required hospital treatment, if you answered yes, I would be recommending for contact a GP, have a chat with a medical practitioner. Again, if you answered yes to any cardiac symptoms during the illness, any adverse psychological symptoms, or other enduring symptoms post-COVID-19, such as respiratory, gastrointestinal, or other. So yeah, if you answered yes to any of those, it would be an idea to consult with a medical practitioner first. However, if you answered no to all of those, you've been asymptomatic for at least 7 days, and potentially considered low risk, then that's when you can sort of consider a gradual return to physical activity, and that's something that we can talk about. All right, so a bit of information here as well. There is no clear super evidence-based way to guide returning to physical activity. So really, it's important to listen to your body. Recovery is different for everyone. So really, return to physical activity, it may be cautious. Gradual might be, it should be an individualized approach, and based on subjective activity tolerance as well. Health and medical practitioners can provide more specific exercise prescription, and obviously it can be tailored to each individual's needs as well. So once you're risk stratified and symptom-free for at least 7 days, phase return to physical activity may be commenced then. Another thing important to note as well, if you develop new symptoms or symptoms return, such as a cough, abnormal breathlessness, palpitations, fever, loss of smell, really encouraged to stop, seek medical advice if required, so reviewing with the GP, and then you might be required to restart the phased return to physical activity again when you're symptom-free. And it has been suggested as well to set goals and monitor progress, so the use of a diary can be really helpful. And also important to consider as well that household tasks are considered as physical activity as well. So keeping that in mind when we talk about physical activity. All right. So this is the second half of the infographic. So again, this is from the British Medical Journal by Salmon et al. 2021. So what we're looking at here, this is very, very generalised, and keeping in mind recommended health professional can provide or implement more specific exercise prescription, but as a bit of a general guide, what they have suggested is that for each phase, spend at least a minimum of 7 days, and you can go back a phase if you're finding it difficult. In fact, I would recommend that. Only move forward when you meet the progression criteria. Only exercise if you feel recovered from the previous day and you're not experiencing any new or return symptoms. So you don't want any new or return symptoms. You can also spend at least a few minutes warming up and cooling down, which would be really good. And that would be good to do before and after exercise as well. So I'd recommend that there. Any abnormal shortness of breath, return of symptoms such as temperature, lethargy, or chest pain, seek medical advice. Monitor for mood changes and emotions as well. Have a look at how you're feeling. It's okay to speak to someone. It's actually really encouraged. It's a good idea. And to seek medical advice if you are concerned. Okay. What you'll notice as well, I'll just move myself out of the way. Down the bottom right-hand corner here, you've got the Borg rating of perceived exertion, which is something that we refer to as the RPE scale. Basically what this is a subjective scale about how hard someone feels that they're working. So we ask this in clinic quite a lot for someone to rate how hard they feel that they're working. So that it's a complete rating of their feeling of exertion, shortness of breath and fatigue as well. And this is on a scale of from 6 up to 20. So what I'm going to do now is just briefly go into each phase. Again, it's very generalized, but just sort of break it down a little bit. Looking at phase 1, so just keep in mind it's been at least 7 days being asymptomatic. The goal of phase 1, low intensity activity. So activities may include walking, light yoga, light household or garden tasks. So the suggested RPE, I've gone forward one, sorry. Phase 1, sorry there. Phase 1 is preparation for return to exercise. Okay, so always consider your pre-COVID capacity. This is extremely light intensity activity, minimal to light exertion. Really, you should be able to hold a full conversation without difficulty. Exercises here may include rest, breathing exercises, and flexibility and stretching, balance, gentle walking, those sorts of things. Suggested RPE is between 6 and 8. So as you can see on the Borg RPE scale here, what a 6 to 8, suggested 6 to 8 could look like. And again, that's a subjective measure there. Okay, so they're just some examples. Phase 2 now. The goal here is low intensity activity. So activities may include walking, light yoga, light household and garden tasks, and health professionals will tailor specifically here, but it could look at gradually increasing by 10 to 15 minutes a day at the same RPE when tolerated. So again, suggested RPE being between 6 and 11, which we can see up here is over here. So those sorts of intensities, again, being subjective. When we look at progression, minimum 7 days, and for most people, able to walk for 30 minutes at an RPE of 11. So again, keeping in mind someone's pre-COVID capacity as well. All right, moving on to phase 3. So the goal, phase 3, is moderate intensity aerobic and strength activity. So this is where you might look at progressing to more challenging movement activities, again, depending on your pre-COVID capacity. Some exercise examples, it may include, a couple of intervals of 5-minute aerobic exercise separated by a block of recovery. So an example may be some brisk walking, swimming, cycling, going up and down stairs, but you generally have like an aerobic exercise followed by a block of recovery and then moving back to another block of aerobic exercise. At this point, exercise should not feel hard, should be able to hold a conversation and not be out of breath. So potentially gradually adding 1 interval per day as tolerated, the suggested RPE being between 12 and 14 on the Borg scale, which you can see over here what that could correlate to. In terms of progression criteria, minimum 7 days. For everyone, you want to feel recovered after one hour, but for some people, a good goal and progression criteria would be to be able to achieve a 30-minute session. All right, moving on to phase 4. The goal here It might be moderate intensity aerobic and strength activity, a bit more complex, more movement that challenges coordination, strength and balance. This is where you might look at incorporating training recovery days. Some examples of exercise might include running, depending on what your goal is, whether that includes change of direction, side steps, shuffles, body weight exercise circuits as well. Again, exercise should not feel hard. Suggested RPE between 12 and 14, which we can see on the scale there. In terms of progression criteria here, minimum 7 days. And this is an important one. When fatigue levels are normal, you should feel able to return to baseline pre-COVID level of capacity. And then moving on to phase 5, the goal being baseline exercise. So exercise, you may return to regular exercise pattern. RPE or suggested RPE could be 15 or more, and that's as tolerated. But of course, all of this needs to be tailored to an individual and their pre-COVID level of capacity. So this is an idea of what this may look like. Okay, and then looking at some important things to remember, a lot of information. Bit of an overview. Minimum 7 days at each phase to prevent sudden increases in training load. Stay at the phase you feel comfortable with for as long as necessary. Monitor for an inability to feel recovered at 1 hour after exercise and on the day after. Monitor for abnormal breathlessness, abnormal heart rate, excessive fatigue, lethargy, and markers of mental health concerns. And if symptoms occur or if you're not progressing as expected, go back to an earlier phase of activity and seek medical advice if you're unsure. Looking at some things to monitor. So these are just some examples. It's not an extensive list, but there definitely can be other things that you can monitor. But here's just some examples. So monitoring exercise prescription. Again, this could be the use of a diary. Monitoring your RPE. Changes in mood, your sleep patterns, your heart rate, and for some people, monitoring blood pressure as well can be appropriate. And something else I wanted to touch briefly is exercise volume and intensity. So what we know is physical activity may strengthen the immune system, suggesting a benefit in the response to viruses. So we also know that regular practice of what we call adequate intensity is suggested as being helpful in strengthening and preparing the immune system for COVID-19. So what I wanted you to look at here is on the right-hand side of the screen. I've got this nice model here with the reference below. And what this is showing is the relationship between exercise and upper respiratory tract infection. And it can be shown in the form of a J-curve. So you see through here. What this model suggests is that when engaging in moderate exercise training, the risk may decrease when compared to a sedentary individual, and the risk may increase above average during excessive amounts of high intensity exercise. So what we're trying to discourage people from doing is going too hard too soon. So as mentioned earlier, more of a gradual phased approach. We don't want to go too hard too soon. So trying to not encourage that. All right, so in summary, what you may have learned is that there are some suggestions and recommendations about how to safely return to physical activity after COVID-19, and I presented some of them today. Some of the ideas that you may have learned is that risk stratification, it's important. So we've identified its importance. Ongoing symptoms, so further clinical assessment may be needed there, would be recommended. And once you're risk stratified and at least 7 days asymptomatic, then you can look at considering gradual return to physical activities. Generally speaking, 2 weeks more on the minimal exertion side of things. But if you are concerned or you're unsure, we're here to help. So come and see me, Physio Inc. can come in for review, and we can give you an evidence-based guided exercise progression. So we can assess and also discuss if you need to consult with a medical practitioner or a specialist as well as needed. But anyway, I hope you learned something. And yeah, thank you again for joining. Always feel free to reach out as well, whether that be online, through Facebook Messenger, via email as well. I've also written a blog, so if you would like to have some information that way as well, feel free to review that. But otherwise, I don't